So welcome back. Let's now continue our discussion of eating disorders, and we'll continue with a discussion of the medical complications of bulimia, the medical complications of self-induced vomiting. So something that I did just want to write down is the name of that drug that can be used to induce vomiting. So it is syrup of ipecac. I had to just check the spelling, that's why I didn't write it down earlier. And so as I say, this is obtained from the root of a plant, and I don't know the technicalities of how you obtain it, whether you boil the root or mush the root or whatever you do to it, but it's obtained from the root of a plant, and it contains several related chemically structures, which all have the effect of inducing vomiting, so when they're orally ingested. So they work on the stomach and they trigger the vomiting reflex to occur. And we have actually isolated some of these drugs that are in the syrup of ipecac, and one of them is a drug called emmetine, named because of its ability to induce emesis, which is the fancy name for vomiting. There are others as well. They're all very much so related chemically, however, and they're all present within the syrup of ipecac. Now, as I say, it used to be very, very in fashion to use these drugs clinically in cases of people being poisoned or in cases of people overdosing. We would give them a drug to make them vomit it all back up. That has gone completely out of fashion in the UK. It's not performed whatsoever, and you can no longer buy drugs that are deliberately meant to induce vomiting over the counter. Although in other countries you still can, I believe. But do not go to the chemist in the UK and ask for syrup of ipecac, because either they won't know what you're on about, or if they do know what you're on about, you'll get very strange looks. Bulimia then, the medical complications of bulimia. So we talked about this a little bit earlier. The main ones are electrolyte abnormalities. So the gastric contents contains a lot of protons. It's acidic, and remember the meaning of acidic is containing a high concentration of protons. So if you vomit it all up, you lose that gastric fluid, and the stomach will then replace that gastric fluid, and to replace it, the fluid will come out of the bloodstream, and the new protons that the stomach epithelium is finding to make the new acidic contents of the stomach, it will have to take from the blood, and that will lower the proton concentration in the blood, and therefore will make the blood potentially too alkaline. That is called a metabolic alkalosis. So here we have one of the complications then of bulimia, that it can cause metabolic alkalosis, a derangement of the pH of the blood. So that's number one. In addition, or you might ask, well, is that dangerous? And the answer is categorically that is dangerous. If it becomes extreme enough, then your heart will stop beating. It will cause a cardiac arrest. It will affect the electrical activity within the heart. You'll develop an arrhythmia, potentially a fatal arrhythmia, so most likely ventricular fibrillation, which is a... for those who don't know, let me just have a brief divergence into the topic of cardiac arrests. I felt like I should have a brief talk about this at the end of the previous video, when I talked about how the end consequence of extreme anorexia will be cardiac arrest. So cardiac arrest means the heart stops beating, and it is usually fatal unless it is terminated extremely quickly, because obviously if the heart doesn't beat, no blood goes to the brain, and the brain dies very quickly when it's starved of oxygen and glucose, and so does the rest of the body as well. So cardiac arrest is usually a terminal event. Now, there are multiple different ways in which the heart can stop beating. One of the main ones is called ventricular fibrillation. This is a very common type of cardiac arrest. And what does this actually mean? Well, we'll just have a brief picture of the heart. So remember, the heart has 4 chambers. So here's another picture of the heart. 2 atria and 2 ventricles. So this is the left atrium, right atrium, left ventricle, right ventricle. Now, fibrillation means shuddering. Ventricular refers to the ventricles, so ventricular fibrillation literally means that the ventricles aren't contracting, instead they're just shuddering, they're shaking. That's what happens in ventricular fibrillation. They don't contract properly, they fibrillate instead, and fibrillation does not produce any ejection of blood, and therefore the heart stops beating, it causes an arrest. Why do the ventricles fibrillate? Well, it's when the electrical activity turns to absolute chaos. Remember, the electrical activity within the heart is usually extremely ordered. The electrical impulse begins up in the sinoatrial node, spreads along the atria contract in an organized fashion, push the blood into the ventricles, the electrical activity travels through the AV node, which is around here, and then down the bundle of His, which is in the interventricular septum, along the Purkinje fibers, and then spreads to the ventricle walls, and then they contract and push blood out of the heart. That's the normal way in which the electrical activity occurs, and it's very, very beautiful, very, very organised. What happens if the electrical activity turns to total chaos? So you have impulses going everywhere, almost like a seizure in the brain. So what happens if you have total chaos? Electrical impulses flying in all different directions, everything not contracting at the same time, instead contracting at different times. Well, what happens in that case, if you've got total chaos occurring, is that all the different muscle cells of the heart, instead of contracting at the same time to produce an organized macroscopic contraction of the ventricles, instead they all contract at different times, and you don't get a proper contraction, you just instead get this sort of shaking and shuddering, this fibrillating. So that's what's happening in ventricular fibrillation. Electrical chaos. All the heart cells, instead of contracting at the same time to produce an actual proper big contraction, instead they all contract at different times, and therefore they just sort of shudder and shake the wall of the heart. And that's called ventricular fibrillation, and this is one of the most common forms of cardiac arrest, and derangements in electrolytes such as protons can trigger electrical chaos in the heart, and therefore can lead to ventricular fibrillation arrest. So there you go. Metabolic alkalosis is dangerous, it can kill you if it gets bad enough. Remember, the normal pH of the blood is between 7.35 and 7.45. Now, alkalosis is quite rare. We don't actually see it that often in clinical practice, so I do not actually know how high pH has to go in order for you to arrest from it. I know how low it has to go. Acidosis is far, far more common where the pH goes too low, the proton concentration goes too low, and I know that when it goes below 7, you're in life-threatening danger. When it goes below 6.9, that's the point at which you're almost certainly going to arrest. But I don't actually know what the threshold is going the other way, how high it has to go to actually trigger arrest. What I do know is that if it does go high enough, you will go into cardiac arrest. So dangerous, metabolic alkalosis, and that's a consequence of vomiting. The other big electrolyte derangement is hypokalemia. So stomach contents also contains a huge amount of potassium. When you vomit it up, just as we've discussed with protons, you're going to lose all that potassium. It's going to have to be replaced. It will come from the bloodstream, and therefore the potassium concentration in the blood can go down. The normal concentration of potassium within the blood is between 3.5 and 5 millimolar. If it goes too low, it can again cause cardiac arrest, ventricular fibrillation, most likely electrical chaos in the heart. Now, how low does it need to go in order to cause arrest? It needs to generally go below 2. Below 2 is when we're getting really, really dangerously hypokalemic. A potassium of 3 isn't going to put you into cardiac arrest. A potassium of 2.5 isn't going to put you into cardiac arrest. Potassium below 2 is where you would get very, very scared about it. Potassium below 1.5 is probably where you're looking at going into ventricular fibrillation. So hypokalemia, low potassium within the blood, is another very dangerous electrolyte disturbance that can occur from bulimia. Next then, other big consequences of it then. So there are more minor consequences that I'll just mention rather than writing down. So things like dental problems, when you're vomiting all the time, all that acid's going against your teeth, it's going to erode your teeth, so your teeth are going to get problems. also, if you're sticking your fingers down your throat, often they end up with calluses on their hands and their fingers from doing that, and that's called Russell's sign. So I'll just write that, because that's quite famous. So Russell's sign is the calluses on the hand from triggering the gag reflex with your hand. Dangerous things then. Mallory-Weiss tears can occur, which I'll tell you about what they mean in a moment. And then Boerhaave's rupture. Let me just make sure I'm spelling this right. So the problem with doing it like this is that it's covering it up every time I write. So let me just put this up here. So Boerhaave's rupture. So what do these two things? These are both quite dangerous. Boerhaave's rupture, a lot more dangerous than Mallory-Weiss tears. So if you are making yourself vomit on a regular basis, eventually what will happen is you will either tear your stomach or you will tear your esophagus, and you will then end up vomiting up blood potentially. And if you lose a large amount of blood from this, this can be quite dangerous. That is what is known as a Mallory-Weiss tear, when you tear your stomach or your esophagus from vomiting too much. And it doesn't just refer to bulimia vomiting. If you're vomiting because of gastroenteritis, let's say, if you vomit enough, you can develop a Mallory-Weiss tear. If you're vomiting because of huge alcohol intake, again, you can develop Mallory-Weiss tears from that. So Mallory-Weiss tear just means a tear in the esophagus or the stomach from vomiting too much. So bulimia can cause Mallory-Weiss tears, and it can cause potentially dangerous levels of hemorrhage. Usually it's very small amounts of blood that get lost, and therefore it's not that dangerous. Boerhaave's rupture, in contrast, is phenomenally dangerous. So this is where the esophagus tears so much that it actually tears completely open, so you get a complete full thickness tear. So when we're talking about a Mallory-Weiss tear, we're not talking about a full thickness tear, we're just talking about a tear in the epithelium that causes you to bleed into the esophagus or the stomach. When we talk about Boerhaave's rupture, we're talking about a complete full thickness wall tear. So if I draw the wall of the esophagus, so, like so. So a Mallory-Weiss tear, if you like, would be a nick in it, so a small tear like that that's going to cause blood to come out, whereas Boerhaave's rupture would be a complete tear like that, and that's going to cause major problems. It will be phenomenally painful. It will cause bleeding into the esophagus and also the surrounding tissue, the tissue that surrounds the esophagus, the mediastinum. If it's low enough down in the esophagus, it will cause bleeding into the abdomen. The abdomen is a huge space. The peritoneum is a huge potential space. So if you bleed into the peritoneum, you can lose a huge volume of blood and potentially develop hemorrhagic shock, where you lose so much blood from your blood system that you can no longer maintain your blood pressure, and that can potentially be fatal. It can trigger cardiac arrest if you lose all your blood from your vascular system. Then obviously the heart's not going to have anything to pump anymore, everything's just empty, so that will trigger a type of cardiac arrest, a different type of cardiac arrest, often to ventricular fibrillation. It may be a type where the electrical activity is fine, but you're still in cardiac arrest. That's called pulseless electrical activity. I might just add that on. So another form of cardiac arrest is called pulseless electrical activity. That's where the electrical activity in the heart is actually absolutely fine, but your heart has stopped beating. So one example of what could cause that is if you've lost so much blood that the reason you've gone into cardiac arrest is the heart literally doesn't have enough blood to actually pump anything. So the electrical activity is fine, but you're in cardiac arrest. So Boerhaave's rupture or esophageal rupture is really dangerous potentially, and again this violent action of vomiting can provoke a Boerhaave's rupture. And again, Boerhaave's rupture doesn't just refer to it in the case of bulimia. If you're vomiting loads from any of the other causes, so gastroenteritis or alcohol intoxication, these can lead to Boerhaave's rupture as well. It's a very rare complication of vomiting, but it's a potential complication to have there if you're vomiting on a regular basis from bulimia. Right, so again, I think we've been going for long enough. We'll have a break here, and in the final video we'll discuss briefly EDNOS, and then we'll discuss diabulimia.